achieve the highest standard of sexual reproductive health and rights would determine development for countries in Africa. So, in the same sense, in 2004, the World Health Organization also published a report, about reproductive health strategy. And this was ratified by 191 members of states at the 57th World Health Assembly. And this reinforced the centrality of sexual reproductive health, to societies and economies. If we are going to grow as a society in Kapchorwa here, or in Mbale, we are going to put sexual reproductive health at the center of our plan. So these frameworks are all grounded under the gender and equality to recognize the unchanging importance of sexual health services. You'll find that sexual reproductive health rights are an extremely integral part of any country's development. There are countries with very small populations. They've become very unproductive, that they want people to go there. But for us to produce, we also need to produce mindfully. Are we producing people of value, or are we just producing to populate Uganda? So it's very important that sexual reproductive health is a core indicator of growth and development. So there are aspects within there that shall be spoken about by our facilitators and probably by myself that will speak to us, to our understanding of why we need to give non-discriminatory health care services that reach vulnerable and marginalized population as a marker of achieving gender equality, inclusion, and development. So you find that in Uganda, however, like another country, not just Uganda, we have so many countries in the developing world that are actually facing barriers in having their people access sexual reproductive health services. Not just sexual reproductive health services, but quality, healthy services for their people. And most of these are actually being hindered by barriers that include social norms, traditional practices. We are going to unlearn some of the norms we believe in. Some of those things that we believe in, that once you're a girl, once your breasts start coming, giving birth is okay. It's not just okay. You have the decision to decide when to have that child or no time. So such norms have long tolerated human rights abuse and accommodated bad practices like violence against women. In my area where I'm coming from, you find so many people, their children get pregnant at 15, at 16. They get a small fine and then the children marry off. And those children are going to suffer. Every day they are sexually harassed. It's not marital sex now. That is harassment. Because your father ate money, someone's money. How do you stop that person from violating you? So you find that we have challenges. So our training of today is geared towards supporting frontline healthcare providers and public healthcare policymakers around this region to better address the sexual and reproductive health rights of young people. And by creating, they can do so by creating an environment that is friendly, in which young people can thrive and seek health advice and services. I will speak this openly. Young people are not out there dying with those problems because they want to. Most of those problems are from us who are here, some of us. Maybe not all of us, but most of us. We stigmatize them when they come to us the first time. This girl is pregnant the first time, she has met with an accident. She comes to hospital, you stigmatize her. This person comes to you and you look at them and you're like, but they have their health issues. They maybe come for ARVs. You say, this one who doesn't, you're a woman, this one who doesn't look like a woman, she also wants medicine. And that person is going to kill the whole community. People, we have a problem of not treating some people. So this training should help us to give non-discriminative healthcare services to to all young people without prejudices and stigma. It should help us to improve antenatal, prenatal, postpartum and newborn care for our young people. It should help us to provide adequate and suitable family planning to our people when they come to us. Of course, advise them and give them what works. Let them not just come and just say, that one, give them pills. That one, they're not going to succeed. So, basically, we want to also be able, in this training, we want to be able to eliminate, when we go back, unsafe abortions. I'm not saying you give them safe abortion, no. But they are getting those unsafe abortions because we are not attending to them. They come to you, you stigmatize them, they go back there, they are now stigmatized, they run for the first option they can get. They go to a herbalist, they tell them, you can drink some mululuza. They drink mululuza and the baby is coming out in a very funny way. And the person then dies. And they're being buried, and no one is reporting. So we are saying, let's promote sexual health that is good for everyone.
Once you tell the boyfriend who has come with her or the husband about the challenges and dangers he's going to go through, if you don't manage these infections and you begin jumping from left and right with these women, you are going to block your urethra. And at 25 to 30, you will be having a catheter. Yeah? With the urinal bag in your pocket. You think that boy is going to engage anymore? Who is that boy who wants to move the catheter? Tell me. And how will you enjoy any more sexual issues? I hope you are getting this. But once you scare them, you don't welcome them, you will never see them again. And of course, you will expect to see more and more clients coming in bad stages. You will expect to see more macerated stillbirth. Babies born within, when they are already dead, with blisters, with many things. You get this. So, attitude of health worker is the game changer. I think that's the word I can use. It's the game changer in all public health service delivery. Whether you are in private or government, all those, that is public. You are giving them public service. The only way is the access. How do you access it? So let's have and change our attitude to positively receive these clients and positively communicate calculated statements which are appropriate to the problem.
If we have been having any attitude, kindly let's unlearn that and offer health services, friendly health services. As Hope Mbale, as enabling partner of government of Uganda, we are determined to contribute to zero new HIV infections, but also to generally 95 by 2030. Like you say, someone said, I have noted down, we shall work closely, of course, Emily Corner. I have always, but by the way, she keeps on reminding us, and I have always promised her that we have a big activity that we are planning, that is dissemination, where we want to come as we disseminate. We also information, we also carry out other exactly like HIV testing and other services. And one will be at Kasserem, but we plan to have another one somewhere for such services in the outreach somewhere. I thought we would have it around the CP, but now this one has also come up, so we shall go back and try to plan better to see that we reach those hotspots, give people information, but also offer those services, because we know some of them fear to come to the hospitals, to the health facilities. But when we go where they are, I am sure we shall catch them, offer them the services they need, and those we shall find positive. Definitely we shall link them to care and monitor them closely so that we achieve viral load suppression as one of the methods of reducing the new HIV infections. Good leaders tomorrow. So our generation, we are going, but we need to have a generation that is going to be productive in future, a generation that will replace us. So it is our effort, it's our duty as the stakeholders, as the health workers, to ensure that everyone receives friendly health services. Please, let's not discriminate anyone when they come to us. And the only trick we have here is to be friendly. Once you're friendly to everyone, then they will be friendly to you and they will end up opening up to you. And you will give appropriate services, appropriate medicines, prescriptions. But when you become hard, then they will shy away and they may not open up to you. So you will end up treating symptoms but not causes. And we shall continue having these problems. Thank you so very much.